You had a woman that just had a very bad situation, 27 pounds of fibroid and, pregnant, and just having doctors lacking the empathy, for her and to treat her.
What you just heard is a doctor describing a moment that should not happen in 2026. A pregnant woman, 27 pounds of fibroid, and a medical system that was ready to tell her her only option was to lose her baby and lose her uterus. She found Dr. Pierre Johnson, and he did what many said in the system could not be done. I'm Esther Dillard, and this is The Color Between the Lines. And today, Dr. Pierre Johnson, board certified OB-GYN, a minimally invasive surgery specialist, and the physician known as the Fibroid Slayer, sits down to talk about a crisis that's hiding in plain sight. Black women are 2 to 3 times more likely to develop fibroids than white women. Their symptoms are more severe, and historically, they are less likely to be believed, less likely to be offered alternatives, and more likely to end up in an operating room for a procedure they may not have needed. Dr. Johnson has spent his career changing that, one patient and one surgery at a time. Dr. Johnson grew up on the south side of Chicago. He'll tell you, somewhat reluctantly, that a television doctor put medicine on his radar.
Like, everything was horrible around me, and the only thing positive was the Cosby Show. And so, to that point, like, he was a OB-GYN. He did great things in his community. He had a great family, and I thought that was pretty cool as a kid. And that was, something that at least was on my radar, with sports and everything else. But I had an aunt to push me to do a plan B, and I was like, hey, I can just be a doctor. And then once I said OB-GYN, it came out my mouth, I just started researching it, and childbirth was fascinating to me. And so just went down the pathway from there.
What he found when he got there was a system that was failing the women who needed it most. Black women are diagnosed with fibroids at a significantly higher rate than white women and often at younger ages. Can you perhaps explain why is that and why is it actually happening, I guess, to Black women? Why does race play a role?
Well, I mean, just from medical bias and disparities in access to medicine, that's a big thing. But in particular with fibroids, it's not so much that Black women have just more disease as much; they have way more advanced disease. Because I've operated on Caucasian women, Indian women, Asian women before, but for African American women, one. I believe there are other components to it that we don't pay attention to, such as social factors, stress, chronic stress. People of color are across the board, men and women, are under chronic stress from microaggressions and everything else. Two, just the lack of access to quality foods too. When you look at food deserts, when you look at the availability of quality food, we don't have it as much as other cultures. And then when you talk about the mistrust of the medical system, right? So, the medical system has been used to weaponize against us for centuries. And so when you add all of those things, you have a mistrust of the medical system. The aunts and the grandmothers and descendants of these women have stories, and those stories are real stories, and they pass down to their children. And so now when there are problems that arise, they don't want to go get it dealt with. And then when they do go get it dealt with, or try to, they're met with callous, they're met with lack of options and opportunity, and so they don't, they choose to put it off and not go down that pathway. And then when you add in now on top of that layer is when you look at, we start behind we start behind the starting line from everybody else, right? So everybody else has less debt, get more loans and everything else, and are able to now start families earlier, where we are now finally able to see a little bit of generational wealth, see some opportunities for growth, see cultural advancement, and we're putting families off later. So when you add all of the other things I talked about, and then you look up and you have women that are now in their late 30s, early 40s trying to have a family now, these fibroids have morphed and had an opportunity to morph with the lack of access. So those are the biggest things, or the contributors that I see to the problems with fibroids in women of color.
He's not just talking about fibroids, he's talking about a pattern that shows up in maternity mortality rates, in misdiagnosis, and in the operating room decisions made or not made for Black women every day.
You had a woman that just had a very bad situation, 27 pounds of fibroid and, pregnant, and just having doctors lacking the empathy, for her and to treat her. Even, at the institution I performed the hospital, I mean, at the surgery at, they tried to cancel the surgery. They tried to, just go behind me to not allow me to give this woman her care. But you see that across the board, when people don't look like you, when people don't have the empathy towards you. They don't want to do for you as much. So
He fought the institution and he performed the surgery. He saved the pregnancy and he preserved her uterus. That woman came to him when nobody else would say yes. This is not a miracle. It's what medicine is supposed to look like. You hold a documented 0% repeat surgery rate. That is
Mhm.
phenomenal. When the national average is like 40%,
Correct.
how is that possible when there aren't and why aren't there more doctors doing what you do?
So to your point, what you were saying, like even in your own story where you had surgery and then you had to have additional surgery.
If you're watching this and you have not subscribed to The Color Between the Lines, please do it now. Hit that button, it's for free, and it's how this conversation reaches other women who really need to hear it.
My point of it is that fibroids, when you get them all, when you make a determination as a surgeon to go in and do the meticulous task of removing the pebble size, grain size, nerd candy size fibroids out of the uterus, and you truly make a woman fibroid free. It's not to say that fibroids can't regenerate, they just don't have enough time in her reproductive life to now start from nothing and then grow to something significant enough to be a problem. So she may have a 2 or 3 centimeter fibroid, closer to menopause, but she's not talking about surgery again. And so that's my approach, is to take the time and be meticulous to remove every single fibroid to give her the true opportunity of not having to worry about fibroid regrowth, true recurrence in the future. Most of the times when we talk about these 40%, it's not the meticulousness of the surgeon that we're evaluating. We're not looking at the me's. We're not looking at, people that are going to be diligent about it. It's just like, say, hey, you have fibroid surgery. Do you have to have repeats? And so for that, it's easy for fibroids if you leave a 2, 3 centimeter quarter size, bow dollar size fibroid there for it just to grow.
And for the women who've been told that she has no options, Dr. Johnson says that's almost never true.
Number one, I want her to get a goal, right? Talk about your goal, right? Because oftentimes we just want fibroids removed, but fibroid removal is not a goal, it's a desire. And so no one wants to have that. But true goals, there's only two goals that you can have with your uterus. One is pregnancy, the other one is symptom relief. So, number one, figure out what you really want, because if it is pregnancy, there are far more things that contribute to pregnancy than your uterus. Your uterus is actually kind of last on the totem pole when you're looking at pregnancy. And so determining the goal first and then understanding that fibroids are not just always the cause of infertility. They're not always the cause of even bleeding. They are sometimes just incidental findings that happen to be there and are not really the cause of the true problem. So finding somebody that can really hear you, look at your situation, look at your ultrasounds, MRIs, and then analyze what your true problem is, and now giving you options to help you get to your goal. And so all treatment options should be tailored around what your goals are. But it's never a one thing. Like, you have bad fibroids, you have to have a hysterectomy, or you have bad fibroids and you can't achieve pregnancy. It's never that. You always have options, but they all center around what goals you have.
I know that there are probably women right now who are like me, older women who are done having children, who have been
Mhm.
told that by their doctor, they need a hysterectomy as their only option because of fibroids. And many of them are hesitating because they really just know what that means. When you do that, that means that menopause is right there. So, what do you say
Well,
to
well,
that
that's
woman?
that's that's actually false, right?
No.
So no, it's not.
Okay.
So that's what I do. I do a lot of education to understand what things are. So yeah, we have a healthy fear of hysterectomies because hysterectomies you were the black woman's appendectomy at a point in time in our culture and in our country. And even now, 2/3 of hysterectomies are performed in southern states. So there's a bias, there's a weaponization of the surgery in of itself, but that doesn't mean that it's bad. It is true that our ancestors and women that we know have went through very horrible and brutal surgeries, right, where they didn't have to undergo those when those stories are true. But when you talk about laparoscopic robotic hysterectomies to remove a uterus, those stories are way different than women that had incisions from their privates to their chest. And so when you look at the myths of hysterectomy, one of the biggest myths is that you'll go into menopause. The uterus does not produce hormones at all. It has one job, which is pregnancy. The hormone production is from your ovaries. And so if you have your ovaries preserved in the face of hysterectomy, you don't go through menopause. Now, menopause will happen at some point, whether you have ovaries or don't have ovaries. At a certain point, they will stop working. But at the time of hysterectomy, it is not true that you automatically go into menopause. You can just eliminate the bleeding pain and fibroids that you have. You don't have the opportunity for pregnancy anymore, but you still keep your ovaries and avoid menopausal symptoms.
And Dr. Johnson's work does not stop in the operating room. He co authored a book with two other Black physicians because the crisis he treats every day is also a pipeline problem.
So that's one of my proudest accomplishments in life. Postal Perseverance is a movement to really change the narrative. So when we look at, every field, not just medicine, but law, engineering, and everything, we are marginally underrepresented in every field. We're 14% of the population, but less than 5% in all of these spaces, and been that way. It hasn't changed since civil rights, pre-civil rights. It's been that way forever. And it's that way by design, to be honest with you. And so Pulse of Perseverance is a movement to change that narrative. And so for that, the biggest point of it is mentorship and access to mentors and access to the resources to help us get to these spaces. So Pulse of Perseverance, we've created a mentorship application that's available on Apple as well as Android platforms that basically links mentees with mentors so that they can actually now ask questions and get the tools and the resources that they need to actually get into these spaces. Because it's not that we're not smart enough. It's not that we don't have the intelligence to get there. It's just we haven't been granted the access and we don't have the examples that other cultures have to be able to help our kids, because our kids really want to be successful, but the only examples of success that they see is what's put on TV. Athletes, entertainers, they don't see the me's of the world. They don't see and understand that they can be, lawyers, engineers, and all of these things. So having a platform in which all of these people are there and showing them how to get to it and showing them examples and answering questions is a way to now change the divide, change the narrative so that these kids, these driven kids, have the avenues to success.
Before I sign off, I want to tell you something a little personal. Before my son was born, my husband and I tried to have a child for 7 years. One doctor told me that it was maybe because we weren't having enough deep sex. That made me want to scream. I reported him to the doctor who referred him to me, and I found another doctor, a woman OB-GYN, a fertility specialist in Michigan, and she told me I had massive fibroids and I needed surgery. She removed 23 fibroids and that were clustered around my uterus. She said that when she was done, it kind of looked like a zucchini and like Swiss cheese because of she had removed so many fibroids, but she saved my uterus. After that surgery, I became pregnant. I know what it's like to sit in a waiting room and blame yourself. I also know what it means to find the right doctor, the one who sees you and who fights for you. This is what Dr. Pierre Johnson does every single day. If you've been told that you have no options, that's not always true. Ask more questions. Find another doctor if you have to. And your body just deserves someone who's going to fight for it, including yourself. Dr. Pierre Johnson's book, Pulse of Perseverance, is about changing the narrative for the next generation of doctors. The link is in the description below. And if this conversation made you see something differently, please share it. educators. Discussion questions and resources are in the description. And if you're not yet subscribed to The Color Between the Lines, please do it now. That subscription is free. Dr. Johnson reminds me and you that you always have options, but only if someone is willing to fight for them. I'm Esther Dillard. This is The Color Between the Lines. And remember, your story matters.